we have with us today a great leader from Texas, a gentleman that Trey Hairston's been telling me about for the last couple of years. The governor has been bragging on him. He really is a pioneer and set an example that we all can follow. It's Dr. Richard Wainerdi, and he's President Emeritus of the Texas Medical Center. He served as President and CEO of Texas Medical Center from 1984 through 2012. During his tenure, the campus increased dramatically by almost any measurement, including number of acres, patient count, employees, student enrollment, the physical plant, and the amount of money awarded in research grants to the institution. You name it, you can measure their growth in leaps and bounds. His leadership was one of the successful coordination of a 54-member institution campus by encouraging collaboration. Folks, what did we say was important? What did Bob Hess lead us in focusing on? What do we know makes a real difference in Mississippi? And folks, I think this is Mississippi's secret weapon. While Texas has a Texas-style attitude, Mississippi has a unique secret weapon because we are a relatively small state. 3 million people scattered over a lot of geography, but the interconnections that we have, because we're a small state, set us apart. So if we can leverage these interconnections and focus our secret weapon on solving a challenge like this, that will help us develop that Mississippi attitude and follow the lead of that Texas-style attitude. We're going to hear today from a leader from Texas who can say, if you get the right people around the table, if you get the right plan in place, you can and will make a difference. It is a great honor that Dr. Wainerdi has agreed to come here, to take his time to help share with us how Mississippi can be a better place in healthcare economic development. Please join me in welcoming the President Emeritus of Texas Medical Center, a visionary pioneer in this field, Dr. Richard Wainerdi.
Thank you very much, Governor Bryant, ladies and gentlemen. I've got my allergies, so please forgive me. I want to tell you the story today of the Texas Medical Center. It's a story that is very similar to what you're hearing today. It is a story of real success, but in many ways it's a story that is being replicated in other places. While I was president for 28 years, over 130 countries, states, and cities came to us to see how they could build a medical center like ours. So all over the world, people are doing this, and I'm going to mention a few that have been very successful and a couple that are having problems. But other people really believe in this as a way to build a program. So let me start out at the beginning. It turns out that the Texas Medical Center is due to the life of one man, and that man was Monroe Dunaway Anderson. Mr. Anderson was the founder of the Anderson-Clayton Company. He spent his life trading cotton between the port of Galveston and Great Britain. He never married until the last 6 months of his life. He never owned a car, never owned a house. But at his death, his entire estate was a steamer trunk of clothes, a desk, which I still have, and $17 million. That's in the 30s. By the way, that shows you what it takes to bring up a family. In any case, Mr. Anderson was a very, and by the way, to put that in today's context, that's about $250 million today. So that's a bunch of money. Mr. Anderson was a very generous man. He wanted to make sure that this great fortune could be used for mankind. He mentioned that to his trustees, he set up a foundation called the M.D. Anderson Foundation and mentioned to them he wanted to do some good, and he promptly died. So here they had this money, 3 trustees, 2 lawyers, and a banker, and it turns out they all had the same doctor. And the doctor's name was Ernst William Bertner. Dr. Bertner had been the chief surgeon on the staff of General Pershing in World War I, came back to Houston, and he was very disappointed because in the county of Harris, in which Houston is located, there was not one single board-certified doctor, none. And all the people, when they got sick, would get on the train and go to the fancy hospitals in the East, Johns Hopkins and Massachusetts, all this wonderful stuff. And he wanted them to stay in Houston and get care there. So he wanted to build a medical center in Houston. And he wanted to build what he called an Asclepian medical center. Now, there are probably one or two of you who don't know who Asclepius is, but he's the guy, he's the son of Zeus, and he's the guy who has the snake on his staff. He's the god of health. And so he had this idea, and he had these three guys who had all this money who were his patients. Now, you know when you go to the doctor, there's certain times when the doctor can be very influential on you. And he got them down there and he said, I want to do this. I think this is a great idea. I want you to pay attention to this. And they said, I don't know. There's a great medical center in Galveston, Texas, 60 miles away. It's actually pretty small at the time, but it was there. And he forced and pushed. And he turned out, by this time, this is in the 30s, early 40s, he was the chief of staff of the Herman Hospital, which is located way out in the country, an oyster shell road. Where was, I mean, it was just no place. He said, let's build it here. And let's buy the land around this hospital and build it. Well, they decided, all right, you know, it's an easier thing to give in. And they put up they bought 134 acres of land for $3,000 an acre. And in order to buy it from the city of Houston, they had to get a referendum bond election passed. Smallest turnout in the history of the state. 900 people turned out. They got it passed, bought it, and then they had this medical center that they called it very grandly. Well, if you're going to have a medical center, the first thing you got to do is have a hospital or something. And at that time, the state of Texas was negotiating in the legislature to build a hospital for the criminally insane and people who had cancer, one hospital. The reason for that was that these were shameful things, and you wanted to put people away if they had those things. Well, saner heads prevailed, and they put the hospital for the criminally insane in Rusk, Texas, where it still is. And they said they'll build a hospital for people who have cancer in any city that will provide land and money. Well, what an idea. Here was some land. The Anderson Foundation stepped up and provided some money, and they attracted this hospital. But they said, wait a minute, to the state. You can't have this hospital here with all these things we're going to provide to you unless you name it after Monroe Dunaway Anderson. So they named it MD Anderson Hospital for cancer. Well, the first sign said, because, you know, when you set up a hospital, you have to attach it to something that's permanent. Well, in the state of Texas, the most permanent thing is the University of Texas. So they had a big sign that says, University of Texas, MD Anderson Cancer Center. Of course, today the sign says, MD Anderson Cancer Center, University of Texas. And it is today the largest and most famous, and most people think the best cancer center in the world. Next thing that happened was there was a medical school up in Dallas, which wasn't really happy. They weren't getting along with the medical society up there. Medical society didn't like them. And so basically the folks from Houston went up and bought themselves a medical school. They said, you come on down here, we'll like you better, we'll give you some land, we'll give you some money, and you'll enjoy yourself. So Baylor, it used to be called Baylor University School of Medicine, now it's called Baylor College of Medicine, came down, started in an old Sears Roebuck building, and now is in Houston, and was the first medical school. We now have 3, but they came in. Well, next thing that happens is the Methodist Hospital, 80-bed hospital downtown, was invited to come out for some land and build a 150-bed hospital. Well, Mrs. Ella Fondren, whose husband had founded Exxon, said, I won't give you a dime unless you build a 300-bed hospital. Today, Methodist Hospital is one of the largest private hospitals in this country. At this point, a clothing salesman and a lawyer got together and said, we need a children's hospital. So they started Texas Children's. Today, Texas Children's Hospital is the largest pediatric hospital in this country. And then the Episcopalians heard that the Methodists were coming out. And so St. Luke's Episcopal Hospital was founded. I am not going to take you through 54 institutions, but I will tell you that an interesting thing happened a year ago. I got a call from the University of Texas Medical Branch in Galveston. They want to join up. So we now have a Texas Medical Center, a hospital in Galveston, University of Texas Medical Branch. We have MD Anderson has something in Orlando, which we communicate with telemedicine. We have 21 AIDS hospitals in Africa, 3 in Romania. It's growing. Today, the Texas Medical Center is the largest medical complex in the world by far. There's nothing close. Our annual budget is $14 billion with a B. We have 95,000 employees, and we see 80,000 patients and their family members every day. We're the largest parker of cars in this country, in one place. We also make 160,000 tons of chilled water, which is 4 times the chilled water capacity of the Pentagon. And we do a lot of things. But the most important thing that we do is what I call constructive competition. You can compete, but it's got to be constructively. And you have to answer a question if you want to be part of the Texas Medical Center. Is what you're doing good for the health status of the community? If it is, do it. If it isn't, don't do it. And by the community, we mean the city, the state, the nation, and the world. And your research is going to help people all over the world. We're going to have telemedicine helping people all over the state and rural areas. UTMB in Galveston is the largest telemedicine in the world. We take care of, for example, virtually all of the prisoners in our state prisons. And by the way, in Texas, that's big business. For $9 a day per person. In Los Angeles, for $48 a day contact, they get poorer care. And we've had all kinds of outside people check to see we're giving really good care, and we do. So I think what we've said and done is to show that you can work together. Now, what are some of the ways in which you do that? Well, first of all, we have 23 councils. And the way the councils work, for example, a council of nurse executives, which are the deans of our 6 nursing schools, and the chief nursing officers at every hospital or institution. We have institutions which are not hospitals, like Menninger Clinic, which is mental health, and so on. But we do have this Council of Nurse Executives. They meet monthly, and they discuss what should we be doing in nursing education, what should we be doing in nursing practice, how should we get more nurse practitioners, how should we help the rules and so forth that cover nurse practice, and so on. We have one for pharmacy, directors of pharmacy care in all the institutions. And we have 2 pharmacy schools, they're deans, to make sure that when they're preparing kids, we're getting what they need. We have a community college of health careers. And by the way, a lot of the kids in the community college get job offers before they enroll. 2 weeks to 2 years, and you'll get a job. And there's waiting lines for the people to hire them. We also found that we were having problems getting kids qualified for our university level things. We have 9 universities in the medical center. And so we started a high school. Dr. DeBakey started it. It's called the DeBakey High School for Health Professions. 85% minorities. Every single kid goes to college, 100%, with great scholarships. And now we said, some of the kids aren't ready for the high school, so we just started a middle school for health careers to get them ready for the DeBakey High School. So we have community college, universities, and we have 37,500 full-time students, 95,000 employees. It's big statistics, and it runs like a city. Today, the Texas Medical Center, with almost 48 million square feet, is the 11th largest downtown in the United States. By the way, we have more square footage than downtown Houston. We use about 200 megawatts of power. They use about 200 megawatts of power. And we do things on a pretty big scale. But remember, when you talk about medical corridors, we also have branches all over the community. We have hospitals and everything all over the place because a lot of people don't want to come in for just small stuff. Primary care is done everywhere. Secondary care is done anywhere. Tertiary and quaternary care, usually they come in to the medical center. But we have satellite medical centers that are pretty big too. The key thing that I think you all need to remember, and Mr. Hess spelled this out very well, this is a deal of a lot of different groups. And one of the things we've been pointing out to folks is that healthcare is the second largest industry in Houston. But we include, and the first, of course, is oil and gas. But we include every drugstore, every veterinarian, every nurse, home health care, whatever it is. We're all in the healthcare business, and we work together. Now, I told you about these councils. We have a council of government affairs. Now, the Texas legislature only meets every 2 years for 140 days. This year, they got a little extra time because they didn't do exactly what the governor wants, which happens in some places. But, and we have a saying in Texas that we're never safe when they're in session. However, this year, we got several things through that we wanted. And the way we did that is we meet and all gather, what do we really want to push together? And we all decided we want to push children's health insurance, CHIPS. So that became one of our deals. We also wanted to make it easier for nurse practitioners to practice their profession, and we got that through. And we wanted better immunization numbers, and we got some help there. So when we get together, we work together. And one of the few privileges I had in the 28 years I was president, I could go to Austin and say, we want this. And that's very powerful when you're talking for so many institutions, all of whom they know. By the way, I'll tell you a little story. We were having a little bit of trouble getting understood in the legislature. So we have 2 Shrine hospitals. And we went to the Shriners. Now, they are in Texarkana and everywhere. They're the Buick dealers. They own the department. The legislatures know them. And we just have them go see the legislatures. And guess what? It wasn't just a Houston deal. It was a Texas deal. And by the way, we didn't call it the Houston Medical Center for a reason. We want to represent everybody. Now, Dallas sometimes think we're a little bold, but we do. And so we have our organ transplant thing goes all the way up to Fort Worth. We have blood centers that cover all of East Texas and so on. So that's where we are now. I want to spend a few minutes talking about the future because I promise you everything in healthcare will change in the next 10 years. Everything. Not just the Patient Protection and Affordable Care Act as it's properly known, but because of the fact we can't continue to do what we've been doing. We have very high costs, and really, by all measures, our outcomes in the United States lag behind other countries. So what do we have to do? Well, first of all, we have to remember that healthcare represents 18 or 18.5% of the gross national product of the United States. 1/3 of that, more than 6% of the entire gross national product of the United States, goes to pay for things recommended by no grandmothers. 6 things. Get 6. Smoking of cigarettes, abuse of alcohol, violence, promiscuity, the recreational use of drugs, and obesity. You take those 6 things out, 1/3 of all the healthcare costs disappear. Better health, less suffering, and so on. Now, people say, well, you can't really do that. You know, you got to be modern. All these things, people enjoy doing them. Well, there's a problem. There's a problem. And the problem is that they're bad for you. And more interestingly, in every religion, every major religion, there's an injunction not to do it. In Christianity, in Corinthians, it says, take care of yourself. In Judaism, in the Torah and the Talmud, it says not only take care of yourself, but you got to take care of the people around you. In the Quran, it says this. In the Eastern religions, it says this. The majority of people in the world are of faith. So maybe they'll start practicing their faith. And maybe they will start doing what they should. You go to your grandmother and you say, grandmother, what should I do? And all grandmothers will say the same thing. Behave yourself. And if you do that, you stay healthy. If you don't, one of the things that people are going to find out is that governments don't have any more money to take care of you. It's over. And so what people are going to have to learn to do is very important, and that is what we call prevention. Now think of the present health system as a cliff. People fall off the cliff. We have fantastic ambulances and hospitals, and we fix them. We want to put a fence at the top of the cliff. And so where for all these years we talked about doing research, education, and humane patient care, we now talk about, as more important than any of those, prevention. And so one of the big things people say, well, where is the money in prevention? Let me tell you where the money in prevention is. You have an automobile plant. Let me tell you what Toyota has in every automobile plant. They have a clinic. And the clinic is run by local doctors. And the clinic takes care of the employees and their families. So they don't have to leave work. They get cared for. And guess what? Their health care costs are less. Their efficiency is higher. In the Medical Center Corporation, which is the umbrella group in the medical center, I set up a clinic 17 years ago. And we take care of not only our employees, but their families, and we have a nurse practitioner running it. Now, the big advantage of all of that is that you have not only less costs in health insurance, but you have greater productivity from your employees. So really, in Bob's talk, he talked about the infrastructure really as the quality of life where you are. People always think about grade schools and high schools. They also need to think about the health of the community. And one of the things that the governor has championed, which is very important, is a school of public health in this state. Because a school of public health can take care of the general health of the people, not just the individual health which physicians take care of. And that's a very good idea. Additionally, the great new medical school you're starting is fantastic, but don't forget all the allied health. And one of the things in those corridors you can have are community colleges, training programs, all kinds of things. The people who take your blood when you go to the doctor's office is called a phlebotomist. You can get it in 90 days. There's a waiting list of jobs open. There's jobs open for people who are phlebotomists. Virtually everybody in healthcare has one other big advantage. They can work their way up. You can start as a phlebotomist, go to night school, go to weekend school, get more and more training, finally become an RN, then become a nurse practitioner. And there's no limit. Healthcare is almost the best of the fields in terms of lack of discrimination against anybody. We have more women employees in the Texas Medical Center than men by far. You say, well, they're a bunch of nurses. No. They're presidents, and they're surgeons, and they're whatever they want to be. Today, there are more women in medical school than men. So I think what I want to say to you is, yeah, it took us 70 years. But I want to give you another one that didn't take 17 years, and that's Amarillo, Texas. Amarillo, Texas came to me 30 years ago and said, we'd like a medical center like this. We were a third the size at the time. They took our bylaws, they took our charter, and they started the Harrington Medical Center in Amarillo, Texas. I don't know if any of you have been to Amarillo, Texas, but the way in from the airport in Amarillo, Texas does not look like the way in from the airport in Jackson, Mississippi. It's lots of nothing. And today, at the Harrington Medical Center, 1 million patients a year or more come every year from 5 states. Now, why do they do that? They do that because they get great care at the Harrington Medical Center. City of Buffalo, New York, is starting a medical district in the middle of Buffalo. It's doing very well. They have 9 institutions in it now. They call it the Buffalo Niagara Medical Center. In Denver, the city of Aurora and got the old Fitzsimmons Army Hospital, and they're building a wonderful complex with the University of Colorado and everybody coming in. There are a lot of states doing this. I run around the country talking to lots of people. I have never, in the whole United States, seen in his enthusiasm that I've seen this morning and the kind of thing I read in that report and what the governor has put together. I haven't seen it anywhere. There's no reason you can't do this. But it is very important, really important, that you have your plan, that you follow your plan, and that you don't figure that there's some reason that you can't do it. For example, just to give you an example of what's in your plan that I think is so strong, is hooking it to economic development. I've never heard of anybody just hooking it that way. Most of the ones talk about, well, we'll have better health. You're going to have better health. But hooking it to economic development gives you something that's sustainable. The big problem in these medical centers that I've seen is how do they sustain themselves? How do they have income to keep doing those wonderful things they do? We run a very large parking operation, and we make $1.7 million a week. We run a newspaper. We're in food services. You talked about a laundry. We have the largest medical laundry in the world. It's a little different. It doesn't have 100 employees. It has 4 because it's completely automated. It's all full of robots. But we have some people who maintain the robots. And so what we did with that was start offering medical laundry services to East Texas. We do virtually all the medical laundry service in East Texas and Houston, Galveston, and so on. Another very big operation, as I mentioned, is our Thermal Energy Corporation, which makes 160,000 tons of chilled water and now is making electricity and steam and everything. Interestingly enough, they have one GE jet engine from a 747 that makes 48 megawatts of power. As I told you, the entire city of Houston, downtown, uses what would be the equivalent of 4 jet engines to power the downtown. So they're all, and by the way, we have a lot of natural gas. You all have natural gas is now, not only is it going to be inexpensive, but it's going to be forever in this country, at least long before our grandchildren need it. So I think the pieces are lining up. And I also think that the leadership you've seen and the enthusiasm you've seen is just terribly important. The trustees of the Anderson Foundation today are still pushing me, do more, do more, do more, go, 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 today. And they have been our benefactors ever since. But there are plenty of benefactors here. And one of the things I believe is doing it your way. It shouldn't be done our way. The Buffalo people are doing it their way, but you should do it. And you should do it right away. I appreciate this chance to be with you. It's an honor. And I look forward to coming back and seeing this blossoming out and rivaling anybody. Thank you very much.